Option 2, we're going to discuss Cobra. So Cobra stands for Consolidated Omnibus Budget Reconciliation Act. I'm saying that on purpose because a lot of people, kind of find that a mouthful. But basically, keep in mind, it is a law that entitles you to continue your group coverage for a limited time at your own expense after you've been terminated. Okay? So it gives you the option to continue your employer group plan for a limited time at your own expense. And generally speaking, the federal Cobra Assistance is only available to those who work for employers that have 20 or more employees. Who is eligible for this? So if you have been terminated, willingly or unwillingly, you would be eligible. There is one exception. The exception is gross misconduct. Spouses and dependents of the employee are also eligible, and Cobra rights may be exercised individually. That means if you have a family of 5, in addition to the employee, any one of the family members can exercise that right and continue their coverage. The advantages are Cobra provides valuable coverage for someone who may not otherwise qualify for any other policy because of pre-existing condition. If someone is in the middle of treatment or they have a serious health condition that may disqualify them, Cobra would be a very good option for them. It also allows you to keep the same coverage, same physicians. Basically, you pay the same co-pays. You keep the same plan, and you can keep it as an employee. As an employee, you can keep it up to 18 months, and as spouses and dependents, in some cases, up to 36 months. Disadvantage, obviously, Cobra costs quite a bit. Average Cobra premium is around $400 a month for an individual and $1,200 for families. And it's up to 60% more expensive than the average individual coverage purchased online. The other disadvantage is that it's a temporary fix. So you can continue that for 18 months, and if you work for an employer that has less than 20 employees, you may not qualify for the federal Cobra. Option 3, we're going to discuss Cobra with federal subsidized premium. So on February 17, 2009, the Cobra provisions of the American Recovery and Reinvestment Act was written into the law. The Act provides for a federal subsidy of 65% of the Cobra premium for qualified beneficiaries. In order to be eligible for the subsidy, there are mainly 3 requirements. Number 1 is that one has to be terminated on or after September 1st of 2008. There are not any, this is a pretty hard and fast rule. One has to be terminated on or after September 1 of 2008. And the second one is that at the time of termination, you must have been enrolled in your group health plan. So if you were enrolled, any family members were enrolled, they would all be eligible. And third is the income qualification. For an individual, up to $125,000 annual income, and for the family, $250,000. The advantage, obviously, you get 65% of your premium paid initially by your employer, and your employer is going to be subsidized by the government. Like Cobra, it would be a great option because you cannot be denied coverage due to any health issues, and essentially you keep the same plan, same doctors, pay the same co-pays. Disadvantage is that even with the subsidy, the premiums may be high. Keep in mind the subsidy lasts only 9 months, so you have to be prepared to start paying the full premiums after the 9 months is over. I was calculating, and I came up with this fact. If you actually take advantage of the subsidy for 9 months, and after the subsidy you have to start paying 100% of your Cobra premium, you would have paid back all the subsidy you receive in about 4 to 5 months. So my advice is that before your 9 months is over, definitely start looking around for more affordable options. And then the other disadvantage is that it may not, the federal Cobra and the subsidy applies to employers that have 20 or more employees. So if you have 20 or less than 20 employees, that may not apply to you. Even though some states are actually they offer mini Cobras, and you may be eligible. We can take questions after the webinar if you do fall into the category of a small business of less than 20 employees.